Excellent presentation.
Thank you, sir.
If your patient has a calcium score of 400, would you continue to do the CT angio, or the other, if I word it differently, at what level of calcium score you wouldn't want to do it?
Actually, nobody stops at any calcium level. So once patient comes for CTA, then no matter how much calcium is, some people say it should be less than 400, some people say less than 1000, but practically nobody actually stops.
Why not?
Well, there are obviously the information would be limited. If there's a lot of calcium, the information provided would be less accurate. The coronary stenosis would be overestimated. But if you are compelled to do it, then there are certain tricks, like you have to reduce the heart rate to very low level so that there's very little coronary motion, and you also try to dilate the coronary arteries a little bit so that the impact of coronary calcium is less on the lumen. So in that way it may be useful. But practically most of the people don't stop at any calcium less than 1000. Less than 1000.
Probably
usually.
That is because of the revenue which it generates.
Maybe that is a factor. But if it talks to me just after doing coronary calcium, like just today, one tech from one center called me and asked me that coronary calcium is about 1200. So I asked him to send the patient back to the consultant and tell him that the information provided would be very limited. So will he reconsider doing a conventional angiography instead of doing this? But if he insists on this thing, then we can do it with special precautions. Otherwise, he should consider other modalities instead of going for CTA, because information is limited.
Yeah, I always thought that this CTA is, its sensitivity is, specificity is about 97% for exclusion. For assessment of stenosis percentage, what is it? Is it beyond 60%?
Sorry,
excluding the disease.
as
If the calcium is 0, then it's 97%. But what is the sensitivity about its positive findings, like percentage of stenosis?
the positive predictive value is relatively limited, if there is, especially when there is a lot of calcium. As far as the negative predictive value is concerned, that is excellent. But as the earlier speaker said, that the negative predictive value is 100%. I don't agree with that it is 100% negative predictive value. That would be 100% only if you have excluded all patients with technical artifacts and the limitations of the CTA, and only include those patients who have got excellent images. Only then you will be able to exclude coronary artery disease with 100% certainty. Otherwise, no test is 100% accurate.
First hand, I mean, I had to put 3 or 4 stents in a young man of 40 with calcium score 0. So I think it's no more than 97%.
Yeah,
that's what the literature says.
So basically, in your patient, it must have been the soft plaques there.
Yeah.
If the calcium score was 0, the soft plaques can be there.
Today morning, I showed one case in which the patient was symptomatic and the calcium score was 0. But when we did CTA, the left main stem was 100% occluded, and patient has tight stenosis in the RC as well. So calcium score is of no value in symptomatic people. So that is not the test. That is only an additional test if the patient is already undergoing CT angiography. Then obviously calcium score is done with that. Otherwise, calcium scoring is not the test for symptomatic people.